But just a brief, the Burn Society of Kenya really started that as a group of plastic surgeons who came together to empathize with what is going on about burns. We realized that what's the burden of burns that was coming to us, because usually when burns comes, they say, where are the plastic surgeons to actually manage this? Where are the surgeons to manage this? Now, when we saw the burden was too high, we said, let's form a burn society of Kenya to try and involve other people to see if can we get these patients not to come to the hospital, to prevent them from coming from the hospital, to try and prevent it at the source. That's where we formed. And initially we were just among ourselves and formed a small society. Then we said, let's form this society and get our stakeholders to come and say, how can we get prevention at the source? I really need to recognize two very important people who were the first people to hold our hands. That is Kenya Power Pension Fund and Kenya Power itself. Those are two first organizations. We were so green, they didn't even know us properly. But actually they believed in that, and they were the first people to hold our hands when we started the Burn Society of Kenya. Then came in other people, the Red Cross, then came in the Scouts. Then, as Dr. Kahoro has said, initially we were doing it on our own. We did a burns walk on our own. Then, actually, somebody from Red Cross whispered to us and said, we are duplicating something. There's a group also which is under the National Disaster Management, which is also doing almost the same thing, trying to deal with disasters, and also the HDMU. Why didn't we join? And actually, with the push from Red Cross, actually, we joined the other stakeholders. We became a bigger group. And by that, I'm happy to notice now that we have such a large group, all for something that is not for profit. When I look at the forum, when I look at the page for the forum, I see so many of us coming out, but not for profit, something for your own, in your own heart. Just to give you an example, between around 2019, our figures were around 121,000 burn patients coming in. But 2019, there were 248,982 burns patients who reported into a hospital. Then came to 2020, that is the year of the COVID, we went slightly down to 213,720. The slight drop, we do not attribute it to the less fires, but we attribute it to the fact that less hospitals were opened and less few people were coming for treatments within that time. We are at Kenyatta National Hospital, and I'm just quoting, somebody else may quote these figures. They reported within this time that they admitted 1,406 patients. Remember, somebody coming to a Kenyatta National Hospital is somebody who has been sent from a major hospital like Nakuru, Nyeri. That means a very severe burns coming in for the very specialized treatment. They had 1,406 admissions, and unfortunately they reported 107 deaths out of that. So these figures are actually frightening. Year after year, I would expect them to come down, but actually they are going up. That's why there's this push, even if it's once per year, to hold something, kuhamasisha watu kuvijiji, to bring these people, everybody aware about the dangers of fire. I am very happy that now the group, the Fire Safety and Burns Awareness Forum, is a big group. Fire marshals, St. John's, all these other people who are involved. We are happy that now the group gets bigger, such that I have a friend somewhere. I see it in our group. There's a pole which is hanging badly. Can somebody help? And somebody from Kenya Power says, we have responded, which is really good. That's a fire averted. I see, I'm meeting Madam November for the first time today. I only see her in the group, but she's very active. I see her in Madari, in what. This is really, really, really appreciated. And I am happy to be part of you. I'm really happy to be part of you. The Burn Society of Kenya, actually, our work reduced by 90% when all of you came up. And we're able now to reach the community as a big group. We must recognize and give a lot of gratitude to Kenyatta National Hospital. It has been our mother, and initially when we started everything else, we really relied on the backbone of Kenyatta National Hospital. They have been with us, they have sat with us. I wish to recognize Dr. Wabwire, sitting there quietly. He's the head of specialist service. He's a colleague of ours. But this is a gentleman I just called and he'll sort me out in Kenyatta National Hospital. I didn't want to give a speech. I just wanted to give a background of where we were coming from